Hello all, we're from SGD B7 and in this video, we're going to discuss the pathogenesis of acute appendicitis. We also add the physical examination of acute appendicitis at the end of this video. Appendicitis is an obstructive process due to lymphoid hyperplasia, fecaliths, foreign bodies, or tumors in the appendix. Obstruction is then followed by an infectious process and followed by inflammation of the vermiform appendix. Appendicitis can strike any age, but very few cases of appendicitis under 1 year of age. For decades, researchers and clinicians have been fascinated by the pathogenesis of acute appendicitis. Let's start with obstructive appendicitis. The luminal obstruction due to either a lymphoid obstruction in young people and fecaliths in older patients will lead to increased mucus production and inflammation. We need to remember, appendiceal mucosa continues to secrete normally despite being obstructed. As inflammatory fluid collects inside the lumen, there is distension and increase in intraluminal pressure, which will lead to blockage of venous and lymphatic drainage. The resident bacteria will also multiply rapidly, increasing the intraluminal pressure. The intraluminal pressure will eventually exceed the capillary and venous pressure. However, the arterial blood will continue to flow, thus causing vascular congestion and engorgement. The impaired blood supply results in mucosal ischemia and ulceration with ultimate bacterial translocation or invasion. The bacteria spread through submucosa and muscularis propria, resulting in acute obstructive appendicitis. Inflammation and ischemia progress to involve the serosal surface of the appendix, and the appendicular artery can thrombose and cause ischemic necrosis, which can cause gangrene, perforation of the tip or base, and peritonitis. After perforation, there is localization by greater omentum and dilated ileum. This can separate, forming an appendicular abscess. If pus is not present inside, it is referred to as an appendicular mass. Acute inflammation of mucous membrane with secondary infection without obstruction causes acute non-obstructive appendicitis, which may lead to resolution, fibrosis, recurrent appendicitis, obstructive appendicitis, gangrene, which is rare, peritonitis, and suppuration. Okay, we've talked about obstructive and non-obstructive appendicitis. Now the third one is recurrent appendicitis. Repeated attacks of non-obstructive appendicitis leads to fibrosis and adhesion that cause recurrent appendicitis. The fourth one is subacute appendicitis. That is the milder form of acute appendicitis. The fifth one is stump appendicitis. It retained long stump of appendix after commonly laparoscopic appendicectomy. According to the morphology, we have three types of acute appendicitis. That is acute simple, acute blepharitis, and acute gangrenous. For acute simple, the appendix is slightly tense, and its serous membrane is hyperemic and edematous. And there is odorless serous fluid in the appendicular cavity. For the microscopically, there is mucosal edema and erosions. For acute blepharitis appendicitis, the appendix is thickened, tense, hyperemic, and covered with fibrin, and there is pus in the appendicular cavity, and there is turbid serous or purulent exudate in the abdominal cavity. And the peritoneum is lack of luster in some areas. For the microscopically, leukocyte infiltration of the appendicular tissue, and there is purulent destruction of its wall in some areas. And for acute gangrenous appendicitis, there is necrosis of sections of the appendix wall, possibly perforations of its walls, and there is necrotic detritus in the lumen of the appendix. There are purulent necrotic contents in the abdominal cavity, and for microscopically, there is found thrombosis of the appendix vessels and necrotic changes in its walls. Okay, this is the video of physical examination of acute appendicitis. Hi sir, good afternoon. I'm Dr. Anin with Women. How old are you? Fine sir, if I may know, what are the complaints? Your right stomach hurts, then are there any other complaints? Alright sir, after this I will examine you for appendicitis. Later, I will ask you to remove your clothes and lie on the bed, and then I will palpate and feel where it hurts. Are you ready? Okay, please lie down on the bed and undress your clothes, sir. Alright, the first thing I'm going to do is to palpate the McBurney's point. McBurney's point is the lateral third of the line connecting the aces with the umbilicus. Does it hurt, sir? It hurts? Okay, for the McBurney signs examination, the result is positive. For the second examination is the psoas sign examination. Sir, please tilt your body to the left. Flex the patient's right leg and ask the patient to feel pain or not. It hurts? Okay, for the psoas sign, the result is positive. Fine sir, please lie down again. Well, for the third one, I will do an obturator sign examination. The patient's right thigh is flexed and internally rotated. It hurts, sir. Okay, for the obturator sign examination, the result is positive. The fourth examination is the Dunphy sign. Sir, please try to cough, sir. Does it hurt, sir? It hurts? Okay, for the Dunphy sign, the result is positive. Alright, that is all from our acute appendicitis physical examination video. Thank you for watching.